aching from an old injury, who isn't? Dr. Kircher can ease your pain, help you say goodbye to the pain in the neck or pain in the back. Dr. Kircher, welcome. Hey, and congratulations. You got a new office opening in Mission Valley, right?
Yes, a bigger and better office with more machines, so you don't have to wait as long for your treatment.
All right. Well, that's always good. Yeah. You know, I have learned, though, to whenever I go to any doctor's office, to bring something with me to read or look at. But now, in the offices anyway, there's usually plenty of stuff to do. But the shorter the time of wait, the better. Because, yes, you're usually in a little bit of pain when they come to see you, aren't you?
Oh, yeah.
Yeah.
Get them in and out.
Speaking of that, there's a new technology, right, for these crushed discs, or what do we call it?
Injured disc.
Injured discs, yeah.
Yeah, it's a new technology called spinal decompression. It's non-surgical. It's a computerized table. And what it's able to do is treat an injured disc, such as bulging disc, degenerative disc, or a disc herniation that can cause irritation of the spinal nerves.
Yeah, you know, I always say there are two kinds of people, those with back problems and those under 30. And now that seems to be even getting younger in some cases. So what are the symptoms when somebody comes to you?
Okay, generally if somebody's diagnosed with a disc herniation in the neck, early stages can cause stiffness, pain that will soon radiate down the arms, causing weakness, numbness. Usually people will complain of not being able to hold a gallon of milk or even holding a cup of coffee. And as far as the low back, it can cause pain going down the legs.
Yeah,
sometimes
that's sciatica. Is it always sciatica?
Yeah.
I mean, that's that pain in the, although there can be pain in the front of the leg too, right? Is that the same thing? Because I know there's pain in the back of the leg. I've experienced that.
Yes, there's many branches of the sciatic nerve. The beginning of the sciatic nerve is as big as your small finger. It's the largest nerve in your spine. And that can also cause cramping in your calves, numbness, tingling in your toes.
Oh, wow. Yeah.
So what's nice about spinal decompression is, well, usually a lot of those symptoms are caused by a very slight pressure on that spinal nerve. The weight of a nickel on that nerve can cause all those symptoms. Spinal decompression, it can actually take that little bit of pressure off that nerve and all the symptoms are resolved. And not only that, but it can facilitate in actually healing of the disc.
Wow. And you can do that without surgery?
Without surgery.
I mean, this is the miracle here of this work.
Yeah, brand new technology, and it's frustrating to me to know that all these people out there with these symptoms are suffering needlessly when all you have to do is take that little bit of pressure off the nerve, and they resolve. So,
who's a typical, I think it runs all over the board here, but is there a typical person that comes into the office?
Typically, we see a lot of younger folks, usually a low back injury from working or car accidents.
So they're accidents, I would assume, yeah sure.
But typically an elderly patient. They come into our office, they present themselves usually hunched over or even with a walker.
Yeah.
And they're very fragile looking, and they have a grimace on their face from a lot of pain. And they tell me that they've tried everything. Anywhere from physical therapy, chiropractic care, acupuncture, usually ends up with epidural steroid injections.
Gee whiz, yeah, and that's a degenerative situation once you get to be that age, I'm sure.
Yes, over time or injury, those discs dry out, they become weak.
So can I expect to be completely free of pain? What can I expect from this procedure?
We have some very exciting results. An old fellow that comes to mind, he's about 86 years old. He came into the office and he was yelling and screaming in the waiting room. He's in between treatments. Yeah. And he's throwing his arms around saying, I can feel my hands again. It's been 8 years since I've been able to feel my hands. And when he first came into my office, he was the guy that was hunched over, had the pain, numbness, tingling down his legs.
Oh, my.
He had the neck pain, the numbness. Now he's golfing, and he comes in and gives me golf tips. So
is that right?
Yeah, it's very exciting.
Outstanding. Yeah. Now we've been looking here at this. Is this the machine we're talking about?
Yeah, that's my fancy machine. And it's very gentle. It drops down level, and it gives you a very gentle pull. And it actually rehydrates the disc. This patient here was complaining of low back pain, numbness, and tingling, and now she's out running around.
Boy, you know, I'm trying to think of somebody who doesn't have this situation, who is, you know, over 30. And I know there's some people, I injured my back in my 20s.
Yes.
I think I told you this before. I was racing snowmobiles like a fool when I was young, 25, and I did the same thing and went through the sciatica and the whole problems. And I just might pop in there, see if I can get a little more relief, you know, myself. I think I will.
I think there's some hope left for you.
You think there's some hope for me? Non-Surgical Spine Care Center. There it is. You'll see it there. Decompression.com. It's easy to remember. I'm going to come in. I will be one of your testimonials. All right? You can hang me upside down for a while.
All right.
In the office. I could be, you know, like a wall hanging, perhaps.
We'll do that.
No, you won't. All right. Thank you, Dr. Kircher. San Diego Living is coming right back.